Um, Hold your passports and your evaluations up so that the hostesses can collect them. Make sure you put your name on your passport. Got to have your name on your passport so we can identify you. Okay, I'm going to introduce our next presenter. We actually have two more presenters, and then you get to do your gift card giveaway. Our next presenter is Dr. Kevin Hendler. He's an associate professor of medicine in the Department of Geriatrics and Gerontology. Was recently named the most outstanding dentist of the year by the Georgia Dental Hygienists Association Board of Trustees. Dr. Hendler is special because his specialty is geriatric dentistry, which means he takes care of a patient population that is over the age of 65, and he takes care of many of our patients who have dementia. I like to say that he's the best kept secret. He's not anymore, but you want to participate in the Ina Allen Dental Clinic for some compassionate care and good care. And he takes good care of my 93-year-old demented mother, who opens her mouth for him. In any event, at this time, I'd like you to hear from Dr. Kevin Hendler, all about oral health.
Thank you. That was nice. Okay. So I changed my title a little bit to Healthy Mouth, It's Good for You and Your Brain, which is a little bit different than what's in the pamphlet there. So what I want to talk about is, first of all, what is oral health? I mean, why do we care about all this? Why is it important? What's the relationship to systemic diseases and dementia? And then, okay, after I give you all this information, I'm hopefully a couple of pointers on how to prevent problems too. So according to the World Dental Federation, what you need to notice here, oral health is not just having no cavities and healthy gums. It's really inclusive in everything else. So it's multifaceted, includes ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence and without pain. And what I always like to tell everybody is that if you forget everything, remember that the mouth is part of the body, okay? It's very important to remember that. And this is from the World Health Organization. And again, one thing to point out is that poor oral health can have a profound bearing on general health and well-being. For example, its influence on nutrition. Hopefully everybody had a nice lunch and their teeth worked okay. And then the experience of pain, problems with eating, chewing, smiling, communicating, due to problems in your teeth can have a major impact on functional ability and people's daily lives. And I found this just going through things, I thought it was interesting. This was back from 1919 with Theodore Roosevelt in his obituary, and he had a problem, and they said the inflammatory rheumatism was due, in the opinion of his physicians, to an infected tooth. So this is, a long time ago. Now we're starting to get more studies that we'll get into. And just also for the sake of the talk, there's going to be different terms in there. So sometimes it's referred to as periodontal disease, sometimes periodontitis, sometimes gum disease. It depends who I cited. And the important thing is just sort of an overall summary of what gum disease or periodontal disease is you get plaque on your teeth. The plaque has bacteria in it. It inflames the gums. The gums swell up, and there's a little space between the tooth and the gum that gets bigger, and more bacteria gets in there, and then you start to lose the bone around your teeth, and the teeth can get loose, and the teeth can ultimately fall out. So that's why we want to avoid periodontal disease. So a couple of facts about older adults and oral health, and I just want to point out a couple of them. So this first one, being disabled, homebound, or institutionalized. For example, seniors who live in nursing facilities, increased risk for poor oral health. Down here, gum disease, impact almost 70% of people over 65. So that's a lot of people, and a lot of the things I'm going to talk about is going to be related to gum disease. And then another important one that I'm going to touch on at the end is down here, prescription and over-the-counter drugs. Most older Americans take medications, and many medications, one of their side effects is that you get a dry mouth, and dry mouth has like really significant consequences for the teeth. So why do we care? Why is oral health important? Well, it improves overall well-being. If you have a healthy mouth and a nice smile, you feel better about yourself. You're more likely to interact socially with other people. I mean, look, everybody here, this is a huge social interaction. It improves general health. If you don't have infection in the mouth, if you don't have pain, you're going to feel better generally. And then nutrition. The mouth is the entry where we put all the nutrition in that's going to keep the rest of our body healthy, so we want it in good shape. And then the status of your teeth is going to influence food choices. So we'll talk a little bit about nutrition now that everybody's had a nice, good lunch. Dental status can influence food selection, and this sort of makes sense. If you have pain in your mouth, if your dentures don't fit, if you just don't have a lot of good teeth that are functioning together, you're going to tend to choose food that's easier to eat. And oftentimes that's softer food. And the big problem with eating softer food is most of the softer food tends to be higher in carbohydrates and lower in protein. So now you're impacting your nutritional status because of your teeth. And as I mentioned, eating is a social activity. We're all here together. A lot of people that live in long-term care facilities, retirement communities, everybody goes to a dining room to eat. Well, what happens if you're embarrassed by the way your teeth look? What if you're embarrassed because it takes you a really long time to chew? So everybody's done with their meal, and you're still working on the salad. Well, you may say, you know what? I'm not going to go to the dining room today. Or I'm not going to go on the outing with everybody because I'm embarrassed. So what happens is you tend to socially isolate yourself, and that could lead to depression, which is a significant problem in older adults. So oral health can impact general health, and general health can impact oral health. And I'm going to talk a lot about how oral health is going to impact general health. But general health can impact oral health, and since we're talking about brain health, and we've heard a lot about dementia, that's a classic example. With dementia, it's a progressive disease, so at some point, you're going to forget to brush your teeth. Okay, no big deal, somebody reminds you, here, brush your teeth. But then you're going to forget how to brush your teeth. And that's when somebody has to step in and start providing oral hygiene, and that's where we see a lot of problems, because we don't have a lot of people doing oral hygiene for other individuals. Dental care can have a positive impact on quality of life. If you have pain in your mouth and you get that pain taken care of, you're going to feel a lot better. If you have a broken front tooth, or you have a denture that's broken, and that gets fixed, you're just going to feel better. Really important is gum disease and dental cavities are infections. So don't think about it, I just have a cavity. It's caused by bacteria, so there's an infection in your mouth. Gum disease is caused by bacteria, so that's infection that's in your mouth. And as we'll talk about, well, it says here, so infection in the mouth can cause pain. Infection in the mouth can also get to other parts of your body. And that's what they're saying here. So one of the things is pneumonia. So if you have all this bacteria in your mouth, and there's a pipe that connects your mouth to your lungs, well, you can sort of see how the bacteria can get down into your lungs. You end up in pneumonia. Well, if you've got all these bacteria in your mouth, and your gums are bleeding because you have gum disease, well, that bacteria can now get into your bloodstream. And once it's in your bloodstream, it can go anywhere it wants to go, and as I'm going to show you, including to your brain. And the big thing to know is that dental disease is preventable. So I'll give you things to do. So everything I tell you hopefully won't happen to anybody. So there's been a lot of studies that are finding a connection between periodontal diseases and systemic diseases, and I'll run through these pretty quickly. So I like this one, 1935. Some people out here probably have to take an antibiotic before they have dental treatment done because, well, what you're trying to prevent is subacute bacterial endocarditis. And so in 1935, they found that, hey, there's a connection there. And then as we go along, this was my favorite study. I think it still is. And that was a study where people that had clogged arteries in their carotid artery, so that's the main vessel that supplies all the blood to the brain, they found periodontal bugs in these arteries. So I'm always thinking, like, what's it doing there? And if it wasn't there, you know, that would be a good thing. Well, what's it doing there? As I mentioned, if your gums are bleeding, the bacteria can get in, and once it's in your bloodstream, it can go anywhere it wants. There were studies finding that there is an association between heart attacks, strokes, and gum disease, so they explained that. Then they said, here, we talked about pneumonia a little bit, and then they found associations with diabetes. So they did studies, and they took people that were diabetic, and they treated their gum infections, and they found that their blood sugars were better when they got rid of the disease in the mouth. And that's huge, because that's a big goal of diabetes, is we want to keep the blood sugars under control. And then these continue onward. So we're in 2017, and now they're finding associations between depression and gum disease. So now the brain is starting to get into this. And also, 2018, poor oral health, people with poor oral health were more likely to develop frailty or become frail later in life. So there's a lot of connections here, but we're here to talk about brain health. I mean, a lot of this is about brain health. So now let's come into 2019, and we see a number of studies finding a relationship between oral bacteria and Alzheimer's disease, dementia. So we'll talk a little about these. So this first study, I'm going to talk a little bit more about it in depth, but basically they found that a bug that causes, some bacteria that causes periodontal disease can get into the brain and cause changes that you see in people with Alzheimer's disease. They found that there's an association between people that lost teeth and an increased risk for dementia. Then they did, this is the bacteria, and somebody suggested, well, we've got all these associations. Maybe there's a causative relationship, because up to this point, all these studies that I put up before, they find an association. So it's not, they're not saying, well, if you have periodontal disease, and that's going to cause a heart attack, or that's going to cause a stroke. But there's a pretty strong association that the two are linked. Well, here's the suggestion that maybe this certain bacteria will cause Alzheimer's disease. A relationship between inflammation and dementia. And that's one of the big things with periodontal disease, is a lot of inflammation in your gums. So the inflammation, once it's in your system, it can go to other places too. And then this one, a 5-year study found a connection between periodontal inflammation and mild cognitive impairment. Excuse me. So let's take that first study. So Porphyromonas gingivalis, we can just call it PG because we're all friends here, right? It's one of the bugs, bacteria that causes periodontal disease. There's several of them. They also found that when they did autopsies and they looked at people that had Alzheimer's disease, that these people had this bug in their brains. So they said, well, let's do a study. What happens if, you know, how does it get there? So they took a bunch of mice and they put this bacteria in the mice's mouth over a period of 22 weeks. So they gave the mice periodontal disease, basically. And then they looked at the brains of these mice. And then they had a control group, too, so a group that they didn't give the bacteria to. And what they found was that this bug, Porphyromonas, was in the brains of these mice, but it wasn't in the control group. And to me, that's pretty fascinating, because this is crossing the blood-brain barrier that we heard about before, so that's supposed to be your protective mechanism. And then the other thing they concluded is the changes in the brains of the experimental group were similar to changes that you see on autopsy in brains of people that we know have Alzheimer's disease. And then they said, okay, well, this other study came along and said, you know, we have all this good stuff. Could there be a causation? Are these related somehow? And so we know that from that study, we know that chronic periodontal disease increases the risk of getting Alzheimer's disease, and that relates some to this, some to inflammation. Oral infections in mouse models were shown that the changes in the brain are similar to Alzheimer's disease, and way back in the morning we heard about the plaques and the tangles. That's what they're referring to. So they find these changes in the brains of the mice. Porphyromonas can cause inflammation in the brain, and we know that the inflammation can impact memory. So their conclusion is, which I agree with, maintaining a healthy mouth and managing gum disease with good oral hygiene and routine dental care is likely to reduce the burden of Alzheimer's. So there's a quick and easy way to decrease your risk for getting Alzheimer's disease, is you just have to keep your mouths clean. Okay, so I gave you all this good information, okay? So now you're all thinking like, great, I'm at risk for all these diseases if I don't brush my teeth. So I thought it would be nice to sort of tell you, how to avoid getting all of this. And there are no real secrets, okay? So you have to brush your teeth, and you want to do it 2 minutes, and you want to do it twice a day. And the best time is, I like to say after breakfast and before bed. Before bed is ideally the best time, because when you're sleeping, your salivary flow decreases, and it's just a nice way to, you want things clean before you go to bed. You want to clean between your teeth. And I know flossing is difficult. People don't like to floss. There's really good, interdental brushes that you can use. It's almost like a toothpick with little bristles on it, and those work really good for getting in between the teeth. If you wear dentures, they need to come out every night. I always say you take your shoes off at night because you want to give your feet a chance to rest. You should take your dentures out at night too, just to give your mouth a chance to rest. And when they're not in your mouth, they should be soaking in water. You can put denture cleansers in there too to keep them clean. I always tell people not to use a toothbrush and toothpaste on their dentures, because if you don't rinse off, toothpaste is abrasive, and also if you don't rinse it off well, it can stick on there. And so if you want, just get mild dishwashing soap, and that works well for cleaning them. Dentures are not forever. Some people think I have all my teeth out, good, I'm done. The mouth is always changing, denture stays the same. So dentures occasionally will need to be adjusted, sometimes they need to be relined, and sometimes they do need to be remade. They don't last forever. Limit foods that contain high sugar content. Cavities are caused by the bacteria and the sugar. So the bacteria eats the sugar and creates acid environment which dissolves the teeth. And then routine dental visits to maintain oral health. And also, the other important thing is that we do cancer screenings too to make sure you don't have anything growing that shouldn't belong. What I didn't mention is the likelihood of oral cancer increases with age too. So a couple of things, what else should I be concerned about? Dry mouth. I mentioned it in the beginning. I said a lot of people take a lot of medications, and dry mouth can be caused by medication side effects. And if you're taking a whole bunch of medications, the likelihood that you're going to have a dry mouth is pretty good. It puts you at increased risk for cavities, infections. It makes it more difficult to speak, trouble eating. It's hard to wear dentures with dry mouth. And you can imagine, some of you may have a dry mouth. Some of you, if you ever gone to sleep, you were congested, you wake up in the morning and your tongue's stuck to the roof of your mouth. It's uncomfortable, and people often want relief. And the problem is that people will start sucking on candies, peppermints, lozenges, cough drops. I think lozenges is like a great word, whoever came up with that, because it sounds like it's going to be soothing and it's going to feel good. But they're just expensive sucking candies, and same thing with cough drops. It's just candy that's going to cost more. They're just full of sugar, and you end up bathing your teeth in sugar, and you don't have all the protective mechanisms of saliva. I said medications can impact your oral health. Well, here's just a little sampling of the medications that can impact, lots of them. And then what to do about a dry mouth. So I said stay away from the candies, right? So the best thing is to sip on water, because it's fashionable to carry water bottles around now. You got to stay hydrated. And the other thing that I would recommend too is that you use tap water. Because if you're in a fluoridated community, tap water has fluoride in it, and you're not getting that benefit from bottled water. And there are good studies that show topical effect of fluoride, and I'll talk a little bit more down at the bottom. There are saliva substitutes that you can get over the counter, and these are good. They come in little spray bottles or mouth rinses, and I think better than that, there's oral lubricants that you can get. One of them is called Oral Balance, and it just comes in a tube, and you can just carry it with you and just squirt it in your mouth throughout the day, and it makes everything feel better. If you want to suck on mints, candies, chew gum, you want to make sure that it's sugar-free, or even better than that, you want it sweetened with xylitol. And xylitol is a natural sugar that won't cause decay. The bacteria can't use it to make cavities. If you like mouthwashes, you want to use alcohol-free mouthwashes, because alcohol will dry out your mouth even more. And now, there used to be like one, now there's like tons of alcohol-free mouthwashes, so that's good. And then fluoride. Fluoride, what I like to say, is not just for kids anymore. We give a lot of our patients topical fluoride treatments when they come in to have their teeth cleaned, and we put a lot of patients that are high risk for decay. We also give them a prescription toothpaste that they can use at home for additional fluoride. Other things to be concerned about. We heard a nice talk about dermatology and, watching out. It's a good idea to monitor yourself. So if you have sores in your mouth that do not heal, that's a warning sign. If there's anything swollen and things don't resolve and you don't know why it's swollen, that should be checked out. Red areas, white patches. If you have white patches and you could scrape them off, but underneath it looks like it's all raw, that's a problem. It needs to be checked out. Tingling or numbness, dark spots on teeth, and certainly loose teeth could indicate you probably have periodontal disease and you're in the advanced stages where you've lost a lot of bone. A little bit of tooth trivia, just for everybody. You do not lose teeth as a result of aging. Now, we thought this was connected because, years ago, 60% of people over 65 had no teeth. And now that number is down to under 25%, and depending on where you are, it's even less than that. So you only get 2 sets of teeth. You lose the first set. There's no third set. All right? So whoever designed the human body did a pretty good job, so they figured you only needed 2 sets. The third set sometimes is plastic, and it's not as good. Teeth do darken with age, and that's normal. There's a number of reasons for that. That's why bleaching, people want a nice white smile. That's why a lot of people bleach teeth, just to get that nicer smile as they go. Salivary flow does not decrease with age, and this is not a normal age-related change. And we thought it was because, if you did a study where you took a bunch of older adults and you took a bunch of younger people, and you say, okay, here's a cup, I want you guys to spit in it, and you have 5 minutes, and the young people would fill the cup and the old person barely covered the bottom, it's because you didn't factor in that the older adult was probably taking a whole bunch of medications that dried their mouth out, and that's the main cause. I mean, there are other reasons too. And then people without teeth should still have oral exams. Just because you don't have teeth only means that you're not going to get periodontal disease and you're not going to get cavities. But dentures have a whole bunch of their own problems, and the mouth can still get disease, and you can still get oral cancer as you get older. And again, fluoride is not just for kids. So what should I remember? What I told you in the beginning, right? The mouth is part of the body. Disease in the mouth can influence disease in other parts of the body and impact the general health and overall well-being of an individual. And preventing dental disease can help maintain general health and positively impact quality of life. And I want to just leave you with one story. This was way back when I was doing my residency, and this really stuck with me. So this was a patient that I saw who had suffered a closed head injury. And he was in a nursing facility and difficult to manage. The nurses were having a lot of problems. He was behavior problems. And part of his injury is he had his front teeth knocked out. And they made him just like this denture that didn't fit well. It didn't look good. And he wasn't happy with it. And So the dental director, I was a resident, and the dental director said, I think you should make him a fixed bridge. So basically, front teeth that would glue in his mouth so he didn't take them out every day. And my thought fresh out of dental school was, this guy's oral hygiene is awful, and you shouldn't be doing all this work in people that have, what they told us in school was you don't put jewels in sewers. So because it's going to fail. But I was the resident, this was going to be a great teaching opportunity, and so I made him the fixed bridge. And what was amazing to me is that his hygiene improved. But better than that is that he came back for follow-up, and I said, how's it going? And he said, ever since you fixed my teeth, I feel like my memory is coming back. And maybe, he was in a wheelchair, he goes, maybe I'll improve physically as well. And the other thing, we would go to interdisciplinary case conferences, and what the nurses reported was, since he had his smile back, he was much easier to manage. He wasn't causing all the problems. And this was over 30 years ago that this happened, and I still remember him very vividly, and I remember the case. So I'll leave you with this. The healthy smile is ageless. Thank you.
Questions for Dr. Hendler? I got one. Is it better to have the Sonicare Oral-B rotary toothbrush versus a manual toothbrush?
Okay. All right, first I'm going to give you the disclaimer. I have no financial involvement in anything, okay? So there's advantages to both. The spin brushes are really good, but they require a lot of dexterity because you have to go tooth to tooth. So personally, we like the Sonicare that's got a full head because it does all the work. And it's also really good for care providers because all you have to do is hold it in there and march it around. And what my hygienist really likes about it is there's a timer on it that tells you when you're brushing 2 minutes. So, she likes it. You leave it in your mouth till it goes off. And she actually says 2 minutes on the top and 2 minutes on the bottom. I'd be personally happy to get 2 minutes total, but that's my take on those. Oh, great question. Is anything being done to have dental care covered by Medicare? Yeah, and I was always amazed by this, that Medicare came about to cover the whole medical care for older adults, but not the teeth. And I always thought that was kind of odd. But maybe when it came about, older adults didn't really have teeth. But answering the question is yes. There is. There are a couple of organizations. There's one called the Santa Fe Group, and their whole charter is to get dental care covered by Medicare. There was also a bill, I think it was just introduced last week, recently, into the Congress that would cover dental care, and I think that was specific to people with medical complications, and I think older adults were in there too. And I know that one of the groups that I was in, we introduced a bill that was going to cover medically necessary dental care, which sort of made sense. If you're going to have an organ transplant, if you're having head and neck cancer, the dental care to get you ready for those procedures is not covered, but yet they'll cover all the complications on the other side, so it didn't make a whole lot of sense to me. How frequently should you get fluoride treatments? How frequently should you get fluoride treatments? That's dependent. If you're high risk for cavities, then we're going to get you on everyday fluoride at home, and we're going to do treatments in the office. If you're just somebody who doesn't get cavities, there's always the person that comes along that nobody's done any oral hygiene for 3 months since the last time we saw them. We cleaned their teeth, and it looks like they've been brushing and flossing all day. They're okay. They don't, we'll do it occasionally, but it's individual. Fluoride isn't found. Fluoride, a myth. Fluoride is not harmful in the appropriate doses. If you eat a whole tube of toothpaste, you're going to get sick. But it's actually considered one of the 10 greatest public health benefits to society based on the cost, and like a 50% reduction in cavities in kids. What's that? Filling on? Oh. Okay. Water flossers and water picks, any way you get the plaque off. You really need mechanical means, But I'm a proponent of any adjunct you want to use in addition. They don't replace brushing. So you need to use brushing, you need to get between the teeth, but anything that's going to get you brushing more, I'm all in favor of those. Filtering water, I'm not positive on that. So I think some of them do filter it out, but the tap water, at least in the city of Atlanta, they check it pretty regularly. They give you the reports on what's in it, and the fluoride is important. Geez, now we're getting into the pathology of things. What does it mean if you have a hairy tongue? So it means you have a hairy tongue. So hairy tongue is a thing that you see occasionally. And the next question is, do you recommend a tongue scraper? Yes, I do. Sometimes it's just you get stuff collected, and if you looked at your tongue under a microscope, there's little hairs, little papillae in there, and sometimes they can get full of junk and get a little bit enlarged. And a tongue scraper is good. You can also just use a toothbrush, but my hygienist loves tongue scrapers. So it is a good idea to brush your tongue in addition to your teeth, yes. What are the signs of oral health that one can recognize as causing? I would say, so what are the signs of oral health that one can recognize as causing dementia and Alzheimer's? Again, based on what we talked about, I think it's just poor oral hygiene. So now that we know that there's connections with poor oral hygiene and inflammation in the brain and this Porphyromonas gingivalis bacteria, I think the thing is we just want to keep the teeth clean, and also just the relation to other diseases too. So I think if you see a dirty mouth, that could be a risk factor just for other things, so we want to keep it clean. Okay.
Or do we got one?
No, mouth guard is a whole separate issue. Mouth guard is really just covering your teeth, and people that grind their teeth a lot at night, it's good. I mean, my theory on bite guards is, even if you're not having symptoms, it's cheaper to wear out, to grind through the bite guard than to grind through your teeth. So it's not, the issue with dentures is that you're covering the gum, the soft tissue, so that's the part we want to air out, and the mouth guard's not covering that, so those are good. Okay, with Parkinson's disease. With Parkinson's disease, is it more common to have tooth decay with the pooling of saliva in the mouth? These are good questions. Not really. I mean, and again, as mentioned further, some things are just genetic. If you really wanted good teeth, you needed to find parents that had really good teeth before. But the saliva is actually a good thing because saliva's got important functions. It'll wash stuff away. I think the bigger issue is people that have a dry mouth, and there are Parkinson's patients where the mouth's dry, and that becomes the bigger issue, is the dryness and not the saliva.
Okay. I did have, that's it, but most of these have to do with where do you go to get dental care for low-income people. Is there a dental clinic?
Gee, I guess we're out of time. That's a great question. In the state of Georgia, Medicaid will only cover exams, x-rays, and extractions. It's not going to cover any preventive care. It's not going to cover fillings. As we alluded to before, Medicare won't cover dental care. And there's just not a lot of good places. There are federally qualified health centers. There are a lot of free dental clinics in the Atlanta area and throughout Georgia. And those, unfortunately, I mean, and there's the Ben Massell Clinic, which is wonderful, but it's a product of its own success, and it's hard to get in to get an appointment. But for low income, those are going to be your options, is to find a free clinic. There's the Good Samaritan clinics. I said Ben Massell, and then the federally qualified health centers.
One other option for cleaning is the dental hygiene school at Clayton State College. Yeah. Is that right, Clayton?
Yeah. So if you can get to hygiene, and there used to be a dental school at Emory, but that's not there anymore. But the hygiene schools are really good because I know what they do charge, but it's really cheap. And you'll get a full set of x-rays, you'll get your teeth cleaned, they'll even do periodontal treatment if you need it. And so that's an excellent source.